Welcome to Medical Confessions.
Your remedy for serious medicine. I'm Jen.
I'm April.
And I'm Scott. Today we're going to be doing something a little bit different. We're going to introduce you guys to some faith in medicine. We're going to have some cool stories that'll make you feel good about medicine in general.
Yeah, I like this. What I actually like is not even the topic today, but that you and I went old school with our notes, like we hand wrote them, and April's got the trusty phone, but I know this is a new phone that she cusses at like every 35 seconds,
Yeah.
So I think this is going to be ugly.
I've already regretted bringing it.
Well, you switched. You strayed from my phone, which is the old comfy classic,
Yeah.
so...
Yeah, it's stretching me as a human.
So this topics, we were talking about doing research on this topic, and I think it's one of those that when you're perusing the news, these things pop up naturally, but they're hard to find when you're looking for them, as we all figured out.
Yeah.
Correct.
And the backstories too. Like usually there's just a little blurb about what happened versus like the whole backstory. you know?
Right. But I like it. It's
Yeah.
fun. It's good. So who wants to start?
Well, ironically enough, Jess was looking at Facebook yesterday, and there was a story that popped out that
So you didn't even do your
totally
homework.
used.
Let somebody else do it for you.
Family member did it.
Smart.
There was in Texas. There's a couple married 45 years, but the last 18 years, the husband.
I saw this.
Yeah.
And I don't even have
Oh.
Facebook. Okay, this is a good one. Go ahead.
The husband.
You're excited.
The husband's been taking care of her the last 18 years because of a stroke. Her kids got her a gift to a hair salon, a local hair salon. She got it cut, went home, and then washed her hair, and of course cannot replicate how it looked in the salon. So her husband went into the salon thinking he'd buy all the products to replicate exactly what they did, and they offered to give him a free lesson on how to do her hair. And it's him literally how to hold the blow dryer and curl, and it
Does
was
her
just
hair.
so heartwarming.
Yeah.
Oh, that is awesome.
So he did. He ended up getting the products, getting a free tutorial, and
And then doing her hair every
doing
day.
her hair every day.
That's sweet.
Nice. That is
There's
awesome.
a similar one that I saw that was two of them linked. It was that one, and then there was another one where the wife had early onset dementia. So it was in her late 40s. And so for however many years, she's now been in a care facility, but her husband they knew this was coming. So they purposely sold their family home, and he bought the house next door to this care facility so that he could actually live basically on site there with her.
Notebook
And then
style.
Yeah, totally.
Yeah.
And he actually goes in, and it's been the same amount of time, 15 or 18 years. And they're both still young. If you look at age-wise, incredibly young for her to be, put into a facility before her age, before 50. But same kind of thing. Spends his whole day over there, with her.
Aw.
As married. Yeah.
And
Yeah.
It's exciting. I like stories. I have actually similar. I've got a few, but some is two old couples actually who did the exact same thing. One inspired by the other, but I wrote it down because I didn't memorize things last night. But his name was Larry Swilling from South Carolina, and in 2013, his wife was born with only one kidney when she had kids. Something
I did
went wrong.
good research because I saw that one too.
Oh, did you?
Yes.
Awesome! I love that guy.
I
Anyways,
did my homework
I did
really
not.
well.
Anyways, so he's 78, and she needed a new kidney, and she's been on the transplant list for a while. He decided he was just going to don a sign and go up and down the main arterial in his town, and that said, "My wife needs a new kidney." And can you? And I think it just said, "Wife needs a new kidney," and then it had his phone number or whatever. And he did it for an entire year, and then finally a news organization picked it up, and he ended up getting a new kidney. So that was awesome. And then his wife, said he would have never stopped until he got one. He would have just kept going on and on. And then a few years later, actually in turning over my notes, in 2017, another guy from Utah had seen that story, and his name was Wayne Winters, and he was also 74. His wife was, they were married 26 years. And he did the same thing, and he got a sandwich board and said, my wife needs a new kidney, and and gave the blood type and then his phone number, and then the local news organization picked up on that, and that day he had hundreds of calls of and she got a new kidney that next Thursday.
Oh.
And so just that, being inspired by that, he said, well, I'm just going to keep doing it, and we're going to see if we can get a lot of people to donate kidneys. And his quote was, think about it, we could start a kidney revolution. and he thought that would be great.
That's pretty lofty.
It is, but just kind of cool. People.
And so, is kidney donation? I mean, how do you find out who the donor is?
Well, they do blood typing and
Okay.
things like that. And I mean, at the end of the day, you're always going to need anti-rejection drugs.
Right.
But blood typing, and then kidneys. It's not like the heart. You've got 2 of them, so you can function just fine on one.
Right.
And sometimes when they do kidney transplants, they just leave the old ones in. I worked with a gentleman who had 3 kidneys because he had a kidney transplant, and they go,
They just
yeah,
leave the old one in
they
there?
just left it in there. So I've got 3
Wow.
now, and
Wow.
one
How
that works.
big is a kidney? Like, how much?
It's not. I mean, it's yay big. It's not.
Wow.
It's not very big.
I was
But
like, oh, that
2 of
thing's
them.
weighing me down.
Yeah.
Get that out of here.
I just can't lose the weight.
I just wondered that it's like a donor list. Then once you get typed for it, then you're on a.
Yeah,
donor
it's like
list.
any organ donation. You're on the list, and you've got to
Yeah.
meet certain qualifications to stay on the list. And
So if you're a match for kidney, you would also be a match for any other organ, or
it depends, So like, not necessarily like a bone marrow and
Yeah.
things like that. But so it really just kind of depends on the organ. But most of them, it's just a blood type and
Does he know this
that
stuff?
sort of
Yeah.
It's like
thing.
that was not part of our research. I just threw that out there.
Well, I know
Well-
that you have to be sized for lungs. Like lungs are super.
And
picky.
hearts.
Oh, really?
Mhm.
Yeah, hearts
Yeah.
especially.
I didn't know that.
Yeah, there was actually one. This kid had a super small heart, and they were just trying to have a hard time finding him a
Well, I
heart
guess
because
that
he
makes
just didn't
sense.
have
You
the
think
space.
about how your body's put together internally. Like that would make sense that you have to have like a
Yeah.
car.
Yeah. It's just not going to fit in the garage if it's too
Yeah.
big,
Yeah.
Well, in a lot of my research, I found a ton of stuff on kidneys. Like
Yeah.
it was all over, and it sounds like a lot of people were like, well, someone needed one, and I just
Yeah.
gave one.
Well, it's probably because it's one of the few organ systems where you have an extra.
Yeah, and
Yeah.
you can function just fine and pretty much do everything you'd normally do anyway with
I would
just
still
one.
have this like concern, like, yeah, what if I blow the first one?
Yeah.
Darn it.
I'm
No backup
screwed.
plan. Well, I found a similar story, but it was with bone marrow. And I put myself on the list years and years and years ago as well. Never got a call, but it was back when I was much more diligent about donating blood. But there was a 21-year-old collegiate athlete. He's a shot put, and it sounds like he was a pretty projected to do very well. So his senior year, his name's Cameron Lyle. He ended up getting on a donor list a couple years before, so like his sophomore year. And there was a 28-year-old gentleman that needed bone marrow. He had a form of leukemia, and in order for him to be the donor, he had to give up his track career, and basically the end of his season just quit it all. And I don't know what he was projected, if he was potentially post collegiate athlete or not, but I guess the likelihood of a match for them would be 1 in 5 million.
Oh,
And that's why he said he knew as soon as he was a match that it was meant to be. So he said he never even thought twice about just dropping his college opportunities there. But the really interesting thing to me is he knew when he was donating the marrow, which I think in itself, short-term recovery in the bigger picture, he was only going to elongate the recipient's life 6 months to 2 years. So I thought that was pretty interesting.
Wow.
Not that maybe that was even more important to him, that he was giving this person another couple years to be with his family and stuff. But, the projections still look bad. Like he wasn't going to survive long term from it anyway, but he still chose to derail his own passion and to save this gentleman for 6 months or 2 years. I thought that was pretty incredible.
Well, and transplants in general, bone marrow is like the most painful. It's
Yeah.
brutal. And just to know you're going to go through that, you're like,
Yeah.
oh my gosh.
I hope they don't call.
No.
That sounds amazing.
There's a cool story. A German guy was being treated for leukemia, who also had HIV, and at the Seattle Cancer Care Alliance. And I think this was 2010, and I didn't research this, so don't quote me on the numbers. But so he came in there to be treated for leukemia, had HIV. He ended up getting a bone marrow transplant, and magically both cured his HIV and his
No
leukemia
way.
with
When was
one
this?
shot. This was 2010. He was the first guy to ever be officially cured of HIV. And since then, there's been a lot more, like babies.
I think
They
it
can-
happened to Magic Johnson.
He's still going
He's
strong.
still going. Something was done there.
he's a robot.
Yeah.
But now, actually, since then, they've cured a ton of kids with HIV,
Yeah.
things like that. But He was the first, and I thought, wow, to be giving 2 death sentences,
Right.
and then you get cured of both. Wow,
Well, and
buy a
then think
lotto ticket or
about the
something.
treating physicians and the team about like how daunting it would be to treat somebody with leukemia that has HIV, as far as knowing that the infection risks, and like it just seems like, sorry,
Yeah.
like
You're
what are your
screwed.
chances? This is not going to be good.
Yeah,
So.
and then they're just high-fiving in the thing. Yeah, totally meant to do that.
Yeah.
Meant to do that.
It was a long shot.
Nailed
You
it.
didn't want to get your hopes up.
Yeah, we knew the whole time.
Yeah.
Oh, that is pretty incredible.
Yeah.
How old was the patient?
He was like in his 40s,
Oh,
super
okay,
young.
So pretty,
Yeah.
super young.
I want to say 43. Yeah, no, really
Baby.
young. Yeah.
Oh, that was a good one.
Yeah.
April, next.
Just another kidney story. A 63-year-old rabbi.
We're like bored of kids.
Yeah.
Oh,
Whatever. Who
another kid. We
cares?
got 2 of them.
Yeah, Jesus.
63-year-old rabbi donates his kidney to a stranger.
It sounds like the
You
setup
can't-
for a joke.
You can't even step outside without somebody throwing a kidney at you. Just here, have one.
When asked why he did it, he said, "Scott,
I'm just picturing somebody getting hit in the face with a
The
kidney.
Like, I don't even like
I'm
him,
sorry.
but I'm going to give him my kidney anyway.
All right, sorry.
Oh no,
Continue.
he just said when asked, he quoted an old Hebrew sayings, if not now, when? What do you have?
Mine?
Yeah.
Oh, okay. So this one I thought was really interesting because, like training, medical training, you do different scenarios. So I know probably any sort of, ongoing medical training, they bring in people to act as patients. And so there's a gentleman named Jim Malloys, who's a retired engineer, which I thought was interesting. He actually enjoyed playing victims, patients for different scenarios. So he's been doing it for years at the University of Virginia. And he went in, and I guess he was really good at it. So I don't know if he liked acting more or the medical part of it. But he had a third-year resident named Ryan Jones who was checking on the scenario called for him to act as though he had a AAA, so aortic
Abdominal
aneurysm.
aortic aneurysm.
I always get the aortic abdominal. So he had the symptoms that he was supposed to display, and so he gave the symptoms to this third-year medical student. Third-year medical student did a good job and ended up actually palpating this guy's stomach. And as soon as he pushed in, he could feel the mass.
Oh,
And so he immediately backed off. It was a really good story. It talked about, like he interviewed him, how creeped out he was because he's looking at everybody like, how did you guys do that? That was incredible, because he said it was exactly as he had been trained what it would feel like. So he said he kind of looked back, and then he called the attending physician who came in and checked him. So they took this, the actor in and had him checked out, and he had a 6-centimeter mass in his abdomen.
Oof.
And
Wow.
operated, and they called his wife that day, and they immediately operated. He was not symptomatic, so he had no symptoms.
Was it an aneurysm or a mass?
I'm sorry, aneurysm.
Aneurysm. Okay. I was thinking cancer.
No, sorry,
Okay.
sorry, aneurysm. So they operated, and he lived, and I just thought that was really interesting that he had volunteered all these years to do this, and then the one time that was actually the scenario that he was being, he
That's
had it.
incredible.
Yeah,
Yeah.
completely not symptomatic. And I guess while he was recovering, his wife was there, and they had ran into like 2 or 3 widows whose husbands had come in the same, time frame that he was in there from the same, ailment. So I thought it was pretty incredible.
Feels like he owes a medical student some dinner or something.
Yeah,
Buy
I
him a
know,
beer
but
or
I just
something.
thought,
Jeez.
and then again, him for volunteering all those years to do that, it literally saved his life.
Yeah,
Very cool.
fantastic.
Yeah,
That's a cool one.
I did my homework. I don't know if I mentioned that or not.
You're like the only one.
No, I did homework.
Well, and I went through the ones you guys
It's
had and
hard.
actually tossed them aside because they
You're
were
like, whatever.
kidneys.
Yeah. Jesus. It's raining kidneys. Jeez, we're not going to talk about that. Mine actually is not, it's not good because this young kid died. The reason why I thought it was cool was because big business, you always get, especially banks, you always get that mindset of, you think the housing crisis and, subprime mortgages and how it kind of screwed the economy and everything. So you kind of, down on banks. But there was a gentleman named Ian Gannett in London, and his kid came down with they call it Duchenne syndrome, but it's just a severe. Did you see this?
I did.
Oh, severe case of muscular dystrophy. You get it like when you're 4. Progresses and you don't live very long. Eventually, starts in your leg. You start getting muscle weaknesses. Pretty soon, you can't breathe, and your heart and everything gives out. So
how horrible!
It is incurable.
Yeah.
But his dad worked for J.P. Morgan Chase, and he went into the bosses and said, "Sorry, I'm going to quit my job and try to start a nonprofit so we can research this disease and try and cure it." And instead of getting pissed, they said, "Okay, well, let's help you raise some money." And so they raised $17 million for his startup.
Wow.
And he was able to create 3 startup companies that all focus on curing this disease. I just thought, well, badass for a...
When did he start that?
This was, I didn't even write the year down, but it was it was after 2010. So at some point,
do you know the name of that?
His company is called Solid Biosciences, and then he actually has 3 subsidiaries because they raise so much money.
Right.
And so Solid GT, Solid One, and Solid Suit are the 3 companies he started, and they're each pursuing different strategies. One on treatment, one on cure, one on that sort of thing. So I just thought fantastic for a big company to say, you know what, we'll do that, and we're going to help you. And then to raise that much money, it's like J.J. Watt, raising all that money for the hurricane stuff. That's awesome.
Right.
Yeah. I didn't read the full article. It was too long. I was like, next.
4 paragraphs? What? Ridiculous. I've got more kidney stories to read.
The next one I found, it's not really, I guess, more if you focus on the depression side of things and in elderly. This lady responded to a heartbreaking letter from a senior citizen. The letter came from the neighbor 2 doors down, who, when the lady got the letter, she didn't even know the house was occupied because she'd lived in the neighborhood for a couple of years and never saw anybody. She just thought the house was vacant. But the letter was written in phenomenal handwriting from a 90-year-old woman that was just stating that she was lonely and fearful and asking for companionship from someone just to be her friend. So the lady responded, started up a friendship, and then created an organization called Pen Pals for Seniors.
Oh, that's nice.
So,
yay.
That's good.
Just nice.
Yeah. My turn?
Yeah.
Okay, I have one more. This one was actually like an article within an article, so I didn't get a ton of facts on it, but it was interesting. So she was 25, I believe, and her husband were in a car wreck, and he ended up passing, which I thought was interesting because organ donations typically don't take place with trauma, correct? Or they do?
There is a long list of things that will rule you out for organ donation, and it's actually really hard to find a true viable organ donation candidate. But no, trauma is actually a good one for, 'cause especially isolated head traumas where they're brain dead, but the bodies are
that's
still
what this one was,
solid.
because she had pretty minor injuries. Her husband had a head injury, it sounds like, and he was kept on life support for several days, and then they ended up donating his organs. So she moved on, sad. Several years later, ended up starting to date somebody else. And so as they were starting to date and they got to know, this gentleman kind of alluded to the fact that he had a pretty serious medical history. They didn't really get into it, and then she found out later that he had received a heart. It was 6 months into the relationship when they actually did the math, and then they verified it, and it was her husband's heart that this guy had received.
Wow.
And they weren't even, if I remember right, they weren't even in the same city. So it was like a unique situation. It sounds like you're like getting teared up.
That's crazy.
See, I told you I'm so good. I did a good. Yeah, so it sounds like the recipient of the heart ended up like transplanting as far as his job. So he wasn't even where he was originally at when he received the heart. So her original husband's heart was flown to him, let's say like New York City, and then he ended up moving to something crazy like a small town in Tennessee because of his job. They met, started dating, and it was months into their dating before they figured it out.
Talk
Isn't
about
that weird?
Yeah.
Cool.
Well, in the heart. Like, that's very,
Yeah.
I thought that was interesting.
Yeah, that would actually not weird me out, but how would you handle that emotionally?
I don't know. And I'm not
go
super
either way.
emotional, but I thought about that. I'm like, that would be really crazy to. But then you couldn't. what if she doesn't even really like him? What if she's
Yeah.
like, I can't, you know.
Yeah.
No,
Gotta
I
hang
need
on
to break
Bob.
up with you, but I just, you know.
Yeah, you got a part of Bob, so.
Can I have your heart? Can
And
you
I've
get with
heard,
me?
and I've heard of weird things before where they'll say that, you know, like organ donation, like they have certain, you know, like something changes. I've heard of that before. I don't know how realistic it is or if that's just kind of psychosomatic, but like,
That's cool. Oh, yeah. I don't
Yeah.
know how you would, because you could go like, I don't want to be thinking about this, you know?
Right, with
And
this
so I
new
don't-
person.
Yeah, that would be.
and then there's that other party that's like, well, this is meant to be. Like, what are the odds?
Yeah, like you get married the next day. I mean,
Well, you would.
Only-
well, I might.
Why can we not go to an episode and not rip us?
I'm not Elizabeth Taylor yet. Jeez.
We're
Give me a
getting
few
there.
more decades.
We're getting there.
Oh, anyways.
Straight to marriage.
Yeah. Every time. It's like a trigger in your
No,
brain.
Scott.
There's
No.
there's stages.
Stop getting
There's
married.
places you can go between first date and marriage. It's okay.
Just because you're single doesn't mean you need to get married again. Anyways. So the last one I have is actually a personal story. And so I'm going to try and be respectful of the people because we obviously did not ask them permission. So I'll be very vague. And it's surprising that you guys would probably drive by this particular house all the time and just not know. But there's a person who lives right near where we work, and he, I guess I can say he, is completely paralyzed, neck down, and needs 100% care, everything from catheter change to even coughing. So his spouse several times a day will get on the bed and do abdominal thrusts to help him cough up phlegm in his lungs so he doesn't get pneumonia.
Yeah.
And so we ended up seeing this particular gentleman and just ask, like, you know, what sort of in-home care do you have? Because there's, you know, he's got a peg tube in, he's getting
Yeah.
artificial feeding, you know, everything. And she's like, no, I take care of him.
Do it all.
And I'm like, oh, well, like, did this just happen? She goes, no, for about 15, 20 years now.
Oh, you're
And I'm
kidding.
like, wow. Like, and
And that's a full-time job.
it
Yeah.
is a 100%, and just and we were there for something minor, and because she's oh no, this is the first time I've had to call you guys because I just take care of everything
That's
myself,
incredible.
you know, and then I'm like, okay, well, and we were going down a specific route for why we were there, and she goes, oh no, I can handle this, and she jumped on him and started doing abdominal thrusts to get him to cough while she's suctioning. I'm like, oh,
How
my
old were they?
goodness. That might be too specific. I'm not sure
okay.
how that works.
Okay. I didn't know if they were like middle-aged or if they were older.
Middle-aged.
Yeah.
Yeah.
Wow.
Not super old.
So they were
middle-aged.
probably a young couple when this took place.
Yeah,
Did you know if was it a trauma that happened or
I don't remember specifically how he became paralyzed.
Yeah.
But he was neck down and all, and you know, obviously he's super grateful, and
Yeah.
I just thought, ooh, what kind of love is that? You
Yeah.
know, that's fantastic.
that is?
My-
But again, I think there's probably a little bit of something interesting in almost every medical story. You know, even families that deal with cancer with children or stuff like that, there's going to be some little thing that took place during their treatment or their ailment that was probably kind or incredible or whatever. I just don't think we hear about them.
Yeah.
We always focus on the bad.
Mhm.
So, all right.
Heartwarming.
Heartwarming.
Yay.
We don't often do that.
No.
Well, if you like what you saw or heard today, check us out on our podcast or YouTube video.
Or visit our website, medicalconfessions.com.